I've been homeless about 11 years.
I've been homeless in Detroit for 3 years.
What's it like?
Hell.
I have been frostbitten. I lost a finger.
I got amputated feet, and I just can't handle the cold.
People look at me as if I'm less, that my life doesn't matter. I'm no different than you. It's just that I'm having a hard time right now.
The calendar on Linda Morrison's phone shows 133 days since she first called the shelter hotline. 133 nights sleeping in her sedan, parked behind the library where she worked for 30 years before her pension stopped covering rent. She keeps her retired librarian badge in the glove compartment, a reminder of who she was before the waiting began. Welcome to Homeless People Stories. In 2024, Detroit's coordinated assessment system recorded something that challenges every assumption about who becomes homeless and how quickly help arrives. Families with jobs, retirees with pensions, workers with full-time schedules, all waiting months for a shelter bed while living in vehicles, under bridges, in places never meant for human habitation. Stay with this story until the end. What unfolds here shows how quickly bureaucratic delays can strip away dignity and stability. If it stays with you, leave a comment, support the video, and subscribe. The numbers behind the nights. On a cold January morning in 2024, outreach teams fanned across Detroit, Hamtramck, and Highland Park, clipboards in hand, counting people who had nowhere to go when the sun went down. The final tally: 1,725 individuals experiencing homelessness, 305 of them completely unsheltered, no tent, no RV, no emergency bed, just the open air and whatever cardboard or tarp they could gather. Behind these statistics are real people like David Park, a 35-year-old delivery driver whose income swings between $1,200 and $3,400 monthly. The fluctuation makes him invisible to landlords who demand proof of stable earnings. So he sleeps in his delivery van, showers at the gym before his shift, and keeps his situation hidden from the restaurants where he picks up orders. The pattern emerged starkly when comparing counts across time. In 2015, 151 people slept unsheltered in these same streets. 9 years later, that number had doubled. Families facing housing instability surged 35%. Unaccompanied youth in transitional programs numbered 35 by early 2025. Across Michigan, over 33,000 people navigated some form of housing crisis in 2023, with Detroit carrying a disproportionate share. These figures represent the parent whispering reassurances to a restless child in a minivan, the elder folding a thin blanket as the city stirs awake, the worker pretending everything's fine while living out of a vehicle. Where do you go when every door closes and the sidewalk becomes your only option? To understand how we arrived here, we need to look at the systems designed to prevent exactly this outcome and why they're failing the people who need them most. When help requires waiting, the corridors of Detroit's intake centers tell a story through their worn floors and faded wall paint. Families arrive with everything they own compressed into duffel bags and shopping carts, hope mixing with exhaustion in their expressions. They fill out forms, they wait, and then they wait longer. The coordinated assessment model CAM was supposed to streamline access to shelter. Instead, it became a measurement of how long desperation can stretch. In January 2025, families waited an average of 133 days for a bed. By fall, that wait had extended to 154 days, an 81% increase in the time between asking for help and receiving it. Linda Morrison knows these numbers intimately. At 61, her fixed pension couldn't keep pace with rent hikes after her landlord sold the building. She applied for emergency shelter in March. By July, she was still sleeping in her car, still checking her phone for the call that would give her a place to rest indoors. The gap between need and capacity reveals itself starkly in construction data. From 2022 to 2024, Detroit added 144 new housing units for people experiencing homelessness. The annual need, calculated by advocacy groups, 1,943 units. The math doesn't work. It never has. This is evidence that the current approach isn't working. Repeating the same strategies while expecting different results helps no one. Transitional programs offer 24-month stays with supportive services. But limited accessibility spots leave many unable to qualify. The Detroit Rescue Mission Ministries documented these constraints in 2023 reviews, noting how people with specific needs face additional barriers in an already overcrowded system. The emotional toll compounds daily. The frustration of crowded nights where privacy evaporates, the erosion of spirit when help falls perpetually out of reach, the quiet shame of explaining to children why home is still a parking lot. What's the point of building shelters if the people who need them can't meet the qualifications to get in? The shelter system reveals its limitations most clearly at night, when safety becomes the primary concern and the streets present dangers that numbers alone cannot capture. When darkness brings risk, as streetlights flicker on along Jefferson Avenue, a different calculation begins. People without stable housing assess which corners feel safest, which shadows offer concealment, which groups might provide protection through numbers. The simple act of closing your eyes becomes complicated when you're exposed to everything around you. In Detroit, individuals experiencing homelessness encounter violence at rates 34 to 82% higher than housed residents, according to 2024 data from the National Alliance to End Homelessness. The causes vary: disputes over shared resources, territorial tensions in encampments, opportunistic attacks on those perceived as vulnerable. Andre Thompson, a 26-year-old line cook 14 months into addiction recovery, works double shifts and saves every dollar he can, but with a record that keeps him out of most housing. He sleeps on a friend's couch when available and in his car when not. The nights in the car mean staying alert, doors locked, windows cracked just enough for air, but not enough for intrusion. The city expanded emergency capacity by 250 beds in 2025, yet many bypassed these shelters entirely. A 2023 coalition report found that prior negative experiences, theft, altercations, strict rules that felt punitive kept people away even when temperatures dropped below freezing. In group settings, crowding creates its own tensions. A 2025 Wayne County study showed 45% of people experiencing homelessness viewed shelters as barriers to safety rather than sources of it. The reasons: too many people in tight quarters, insufficient staff oversight, belongings going missing, conflicts erupting without adequate resolution. The cracks in the safety net have widened into chasms, and people are falling through by the thousands. The constant vigilance exacts a toll. Sleep becomes fragmented. Trust erodes. The isolation deepens even in crowds, because sharing space doesn't guarantee safety or community. Can you imagine doing homework in a parking lot because your home is a car? Physical safety intersects with another crisis that accelerates decline faster than any intervention can address: the collapse of health when there's nowhere stable to heal. When bodies break down faster than help arrives, a chronic condition without stable housing becomes a crisis in slow motion. Diabetes requiring refrigerated insulin, high blood pressure needing daily medication and rest, infected wounds that worsen without clean bandages or a place to keep them dry. In Detroit, people experiencing homelessness are up to 25 times more likely to have untreated chronic conditions. According to a 2023 Michigan Department of Health and Human Services report, over 76% reported disabilities in the 2024 point-in-time count. Linda Morrison manages arthritis and high blood pressure. Her medications sit in a cooler bag, but maintaining the right storage temperature in a vehicle through Detroit's temperature extremes is nearly impossible. She's missed doses. She's rationed pills when money ran short. She knows her health is deteriorating, but the wait list for shelter continues. Winter compounds every health challenge. Exposure to cold drives emergency room visits 40% higher among unsheltered individuals compared to housed residents. Per a 2025 Wayne State University study, frostbite, hypothermia, respiratory infections that turn serious without warmth and rest. The system is hemorrhaging resources without ever addressing the wound. Street medicine programs like Detroit's mobile health units reach some people, but the scale doesn't match the need. In 2024, just 17 respite beds existed through Neighborhood Service Organization for post-hospital recovery. Hundreds endure illness without the basic infrastructure: a bed, clean water, warmth that recovery requires. The progression is relentless. Fatigue becomes chronic. Pain becomes background noise. The body's reserves deplete faster than any temporary intervention can restore them. Consider the cascade of complications that unfolds when someone cannot maintain basic hygiene. Skin infections from sleeping on concrete, dental decay from lack of access to toothbrushes and clean water, foot problems from wearing the same shoes day after day. walking miles to reach services scattered across the city. These aren't minor inconveniences, they're conditions that make employment impossible and further isolate people from the very networks that could help them recover. Mental health deteriorates alongside physical health. The constant stress of finding safe places to sleep, securing food, protecting belongings, it creates a state of hypervigilance that never switches off. Andre Thompson describes it as always being on, a exhaustion that goes deeper than missing sleep. Depression rates among Detroit's homeless population exceed 70%, according to local health surveys. Yet access to mental health treatment requires insurance, transportation, and the ability to keep appointments, luxuries that vanish when you're living day to day. The pharmacy becomes another impossible hurdle. Medications require prescriptions, which require doctor visits, which require ID and insurance. Even when all those pieces align, storing medications properly in extreme temperatures. Detroit's summers above 90 degrees, winters below freezing makes compliance nearly impossible. Pills melt, insulin degrades, inhalers stop working. The very treatments meant to stabilize chronic conditions become unreliable. This reminds us that compassion without action is incomplete. Understanding these realities is the first step. The next is choosing to do something about them. Against this backdrop of crisis, a handful of programs are showing what's possible when systems prioritize immediate housing over bureaucratic hurdles. Small lights in a dark landscape, in corners of Detroit where pragmatism overrides policy debates. Certain approaches have proven they can break the cycle. Not perfectly, not for everyone, but enough to show what becomes possible when help arrives before conditions become irreversible. Housing First programs operate on a simple premise: give people a place to live first, then address everything else. No sobriety requirements, no employment prerequisites, no waiting for people to prove they deserve shelter. The results speak clearly: a 98% success rate in maintaining housing stability. According to 2025 reports from the Homeless Action Network of Detroit, the Pope Francis Center serves 250 to 350 guests daily with meals and job readiness programs. The Detroit Rescue Mission Ministries provides emergency beds and longer-term transitional housing. Covenant House, Michigan focuses specifically on youth aged 18 to 24, many of whom have experienced trafficking or abuse. These aren't theoretical models. They're functioning programs with measurable outcomes. People stabilizing, children attending school consistently. Workers able to focus on employment instead of survival logistics. David Park accessed services through a mobile outreach unit that connected him to storage for his belongings and eventually to a room share program. The difference wasn't just physical, it was the restoration of routine, privacy, the ability to plan beyond the next meal. In the data, there are glimmers of possibility: programs that work, cities that commit, people who recover. Community organizations fill gaps that government programs leave open. The United Community Housing Coalition prevented evictions for over 20,000 people in 2023 through tenant organizing and legal advocacy. Each eviction prevented is a family that didn't hit the streets. A crisis averted before it cascaded. These successes raise an obvious question: if this works, why isn't it everywhere? When billions spent don't translate to beds, the gears of bureaucracy grind so slowly that people age out of programs while waiting. In fiscal year 2025, federal housing funding shifted dramatically. HUD allocated only 30% to permanent housing renewals, putting 500 units at risk in Detroit alone. The city needs nearly 2,000 units annually just to keep pace with demand. Michigan Attorney General Dana Nessel filed suit in November 2025 challenging these federal changes, arguing they would exacerbate an already critical shortage. Meanwhile, families continued waiting 154 days on average by fall for beds that might disappear entirely if funding evaporates. Detroit's strategic plan for 2024 to 2028 calls for adding emergency capacity and converting some shelters to permanent housing. The city boosted winter bed capacity to 1,700 with 250 new spots in 2025, yet the wait times grew longer, not shorter. The newly established Department of Human Services, Family and Homelessness coordinates 247 outreach efforts. But with national grants redirecting toward transitional models that serve fewer people, the equation tilts toward shortfall. Where does the money go when every audit shows success but the streets tell a different story? $3.9 billion in national grants shifted to programs with lower capacity. Administrative layers consume resources before reaching individuals. Systems require documentation that homeless individuals often lack proof of income, identification, past addresses, creating catch-22s where the very conditions of homelessness prevent access to help. The balance sheet of suffering shows costs we don't count: trauma, dignity lost, futures deferred. Linda Morrison has submitted her paperwork multiple times. Each iteration requires documents she stored in a friend's basement. Each visit to the intake office means time away from the part-time work she's managed to find. The process designed to help feels designed to exclude. These aren't isolated failures. They're systemic features of how resources get allocated, how priorities get set, how urgency gets measured against bureaucratic procedure. How did we create a system where bureaucracy matters more than urgency? Yet even as government structures stumble, community networks have mobilized to become the support system that formal channels promised but failed to deliver. When neighbors become the safety net, in the shadow of instability that homelessness casts over Detroit, community organizations have emerged not as supplements to government programs, but as lifelines in their own right. Volunteers at the Pope Francis Center don't just serve meals, they provide connection, dignity, a place where people are greeted by name rather than case number. The Homeless Action Network of Detroit coordinated the point-in-time count that documented 1,725 people experiencing homelessness. But their work extends far beyond counting. They advocate for policy changes, coordinate resources across organizations, and keep pressure on systems that would otherwise stagnate. Neighborhood Service Organization operates mobile medical units, bringing healthcare directly to people who can't access traditional clinics. 17 respite beds for post-hospital recovery, street medicine that meets people where they are. These aren't perfect solutions, but they're preventing the worst outcomes while longer-term housing remains out of reach. What kind of city do we want to build? One where everyone has a place, or one where only some do? The community surge illustrates what becomes possible when empathy translates to action. Covenant House, Michigan served thousands of youth in 2024, providing not just beds, but trauma-informed care, education support, and pathways to independence. The United Community Housing Coalition's eviction prevention work kept 20,000 families housed, 20,000 crises that didn't spiral into homelessness. These stories reveal how quickly circumstances can shift for anyone. Fortune and misfortune often turn on details beyond our control. Linda Morrison's situation stabilized not through the coordinated assessment system, but through a church network that connected her with a room share program. After 8 months in her car, she has a door that locks, a bed, privacy, the ability to manage her medications properly and attend to her health. David Park secured housing through a program that accepted his fluctuating income, understanding that gig economy work doesn't fit traditional verification models. He still drives for delivery services, but he sleeps in a bed now, not his van. These individual victories don't solve the systemic crisis. The wait lists remain long, the funding gaps persist, the shelter capacity still falls short of need, but they demonstrate what becomes achievable when barriers get removed rather than reinforced. The community networks that made these connections possible operate on principles that bureaucracies often miss: flexibility, trust, and recognition that people know what they need better than any assessment form can capture. A church congregation that maintains a database of room share opportunities. A network of former social workers who volunteer their time navigating the system they once administered. Street outreach teams that build relationships over months. Learning who needs insulin storage, who's trying to reconnect with family, who just needs someone to remember their name. These grassroots responses reveal an important truth: solutions already exist in communities, waiting to be supported and scaled. The question isn't whether people care enough to help. Walk through any Detroit neighborhood and you'll find neighbors sharing meals, offering charging stations for phones, creating informal support systems that keep people connected. The question is whether institutional resources will align with this community wisdom rather than working against it. Specific actions are emerging that deserve attention and replication. Mobile shower units that travel to encampments, laundry services that restore the dignity of clean clothes before job interviews, storage facilities where people can keep documents, medications, and possessions safe. These aren't revolutionary concepts, they're basic acknowledgments that dignity matters and small interventions create space for larger transformations. Looking forward requires acknowledging both the scale of the challenge and the existence of proven solutions. Housing First works. Community organizing prevents evictions. Mobile outreach reaches people that facility-based services miss. The question isn't whether effective approaches exist, it's whether we'll choose to fund and scale them. For the 1,725 people counted in Detroit's 2024 survey, and the uncounted hundreds who avoided the census, the future remains uncertain. But possibility persists in the programs that prioritize people over process, in the community networks that fill systemic gaps, in the small daily acts of recognition that preserve dignity when everything else has been lost. Thank you for staying until the very end. If these stories touched you, please give this video a like and subscribe to Homeless People Stories so we can keep bringing more real accounts from communities across the nation. Your support, no matter how small, is the fuel for us to continue our journey to find light in the darkness. Links to support are in the description. These narratives aren't just echoes of pain, they're invitations to envision a path forward where compassionate action meets systemic change, where wait lists shrink because capacity expands, where bureaucracy serves people rather than excluding them, where community care gets matched with adequate resources. The distance between housed and homeless is shorter than most imagine. One rent increase, one medical bill, one job loss. The margin is thin for millions of Americans, making this crisis both deeply personal and broadly structural. What we choose to do with this understanding, whether we advocate for policy changes, support community organizations, or simply recognize the humanity in those experiencing homelessness, shapes the city we become. May compassion guide our choices. May urgency match the scale of suffering. And may the wait for shelter become shorter for everyone still counting days.